Good afternoon, everyone. Welcome to our February Town Hall. The topic of today's session is on social emotional development in autistic children and the influence of systems. It is my privilege to introduce our guest speaker, Dr. Raina Factor. Dr. Factor is a postdoctoral clinical psychology fellow in the David Geffen School of Medicine at UCLA, with joint appointments in the Child and Adult Neurodevelopmental Clinic, also known as the CAN Clinic, and program for the education and enrichment of relational skills, also known as the Pierce Clinic. She is additionally working in the Max Gray Child and Adolescent Mood Disorders Program, the acronym CHAMP. Dr. Factor has expertise working with autistic individuals across the lifespan, from preschool to adulthood. By way of background, Dr. Factor has been working with autistic individuals for over 17 years. She completed her undergraduate degree at Emory University, and after graduating, worked as a research associate in the CASRI lab at UCLA for 2 years, focusing on the Jasper intervention developed at UCLA by Dr. Connie Kasari. She then completed her master's and PhD in clinical psychology at Virginia Tech under the mentorship of Dr. Angela Scarpa, before coming back to UCLA to complete a pre-doctoral clinical internship in autism and neurodevelopmental disabilities at the UCLA Semel Institute for Neuroscience and Human Behavior. Dr. Factor's research interests focus on social and emotional development in autistic children, with a particular emphasis on the impact of peers, parents, and family members as mechanisms of change in evidence-based interventions. She has over 18 publications, has received grant funding, and continues to contribute to the intervention research. It is my pleasure to introduce Dr. Factor.
Thank you so much for that wonderful introduction. I am so honored and happy to be here with everyone today. So I will be speaking about social emotional development in autistic children, talking about the influence of systems. I'll talk a little bit more about what that means. And then after, I think we'll have a little bit of time for questions as well. All right. So to give you a brief overview, so I'll be talking about what is known about social development in autistic individuals, also really focusing on the influence of families, school, friendships, and then I'll really be focusing on the peers program and how that is a great intersection of all of the topics that I'm talking about today. And I would like to note that I'll be using the phrase or using identity first language. So autistic individuals, autistic children, because that has been noted by self-advocates in the autism community that they prefer that language. So I will absolutely be doing my best to use that language in this presentation. All right, so I'll start by talking about family systems theory. So a family is a system. And it's really the idea that an individual can't be examined in isolation. We don't operate in a vacuum. We are really part of a family or part of a larger community, which I will also be talking about. And this is based on systems theory, where we can't look at the individual. We're looking at all of the factors that influence that individual. And that's really important in research, and especially in intervention research when we're thinking about social and emotional development, because we are all kind of products of the environments in which we are part of. There are some different family systems approaches. So there's the macroscopic analytic approach, which is looking at the interaction with other systems. So the community, other families, schools, social groups. I'll really be talking about this a lot in today's lecture and presentation. And there's also the microscopic analytic perspective, and that's looking at relationships within the family. So with each parent, maybe between the parents, with siblings. And this is also a very important topic of research and something that I'm very interested in as we're looking at some of these interventions as well. So this is Bronfenbrenner's Ecological System theory. You might have seen this before, you might not have. So there are just lots of circles, and it's the idea that, again, we are part of the community, the systems that we are part of, and it's the nature versus nurture discussion. So to start out, and we really want to think about pro-social behaviors, and these are actions that are intended to benefit others. And so when we're thinking about the development of these behaviors, then it's really important when we think about the influences from these other systems in our lives. So you can see the circle in the middle. So that's the individual, that's each one of us. And there are a couple of factors that are kind of inherent to each of us, thinking about kind of our genes, how that's expressed and how we develop is really a product of these other systems. So there's the microsystem, which you can see here. So you can see family is here, different health services or access to health services, religious organizations, our neighborhood, play area. That's really important for kids from a young age. And as we get older too, it's kind of the social groups that we're part of. You can see peers are also mentioned here, and school as well. Also, our gender and age kind of influence what that microsystem looks like and the impact the microsystem can have on us. Then there's the Meso System, so that's right around here. And you can also see, and why I like this diagram is you can really see how all of the different levels, different systems are interacting with each other and have an influence on the individual. And so from here in the Meso System, we really think about social exchange theory and social norms theory. So it's where we kind of learn what's expected of us in terms of kind of these social norms in our community, in our environment, and social exchange theory. So if I do something for someone, what will they do for me? What does that look like? Then there's the exosystem. And so this is social learning theory. So it's the idea that we kind of learn from an example from what we see and what we're exposed to. So if you look here, this blue circle, so friends of our family, the media, that's a big one. So what we see on television or through video games, different welfare services, legal systems, and services, neighbors. So that's really where we learn. It's another layer of where we learn how to behave. And then there's the macro system, which is on the outside. So that's really thinking about attitudes and ideologies of the culture we're a part of. So what are some of these cultural norms? Again, ideologies, culture. And then down here is the chrono system. And that's really thinking about time. If there are certain historical events that occur during our life. So for a lot of us, COVID has an impact on a lot of us where maybe it wouldn't on some other generations. The Depression would have a large impact on some other generations. It might not on some other generations who weren't part of that. So that's where we think about the chrono system. So it's time. So this is just a way to break down systems. So now I want to kind of pivot a little bit to talk about autism. So what is autism? So really to break it down, it's a neurodevelopmental disorder. There are deficits in social communication and social interaction, and also in restricted and repetitive patterns of behavior or interests. And I'll be talking in a lot more detail about what those mean. Those are the two big kind of core domains that we look at when we're diagnosing autism and when we're thinking about autism as well. Another criteria is that these symptoms must be present in early development. And oftentimes the symptoms aren't fully manifest until later in development. So when demands might increase, especially in terms of social demands, they might increase, and individuals might not be able to kind of meet those social demands. And you might see, okay, there's a little bit of a difference there. And it's also important to think about the clinically significant impairment that these symptoms do cause. So in social, occupational, or other areas of functioning. So this is how autism is diagnosed. So thinking about the prevalence, it continues to just increase. So there's a diagram at the bottom that's the estimated autism prevalence in 2020. I need to update that. The level is now 1 in 44 individuals, and that has continued to increase each year. And it's this question of, are we getting better at diagnosing? Are we diagnosing more individuals? Are more individuals symptomatic? Do they have autism? What does account for this increase? And so that's one of the big questions that we're looking at. It's also about 4 times more common in males than in females. So a lot of the work that you see is predominantly focused on the presentation in males. And because of that, females are often diagnosed later than males because the way that it presents in females is much different than the way it presents in males. In a lot of the research that's being done, a lot of the diagnostic measures, those were based on the presentation in males. So there's a lot of work now to think about, okay, what does it look like in females? Autism does not discriminate. So that's really to say that we have seen and we continue to see autism all over the country, in different countries, in different religions and races, ethnicities. And we're doing some more work to look at that, and also kind of focusing on how that impacts the age of diagnosis, and also our ability to access different resources for interventions. And then also thinking about, when are individuals diagnosed? So most individuals are diagnosed after they're 4 years old. However, it can be reliably diagnosed as early as 2 years of age. There are a lot of projects going on now, seeing how early we can spot these differences, looking at diagnosis, but around 2 years of age is when we feel confident in diagnosing it. All right, so now we're going back to the criteria. So this is based on the DSM criteria. That's the Diagnostic and Statistical Manual. So that's kind of like our diagnostic Bible that we look at when we're making diagnoses. So as I mentioned, I'm going to go into some more detail about these things. So one of the core domains, deficits in social communication and interactions. So this is across multiple contexts, either currently or by history. There are deficits in social emotional reciprocity. And so what that means is there's a lack of reciprocal conversation. So I often think of conversations as like a ping pong match where it goes back and forth. However, for some autistic individuals, they might either kind of dominate the conversation where it's a one-sided ping pong match, or not participate in the conversation. There's also a decrease in sharing of interest or emotions. They also sometimes don't initiate or respond to social interactions. And again, this does not apply to everyone. This is just what we have seen. Sometimes it actually goes to the other extreme where there's a lot of initiation, and that can sometimes deter other children. If a child comes on really strong and says, "Hi, do you want to play with me?" and they've never met before. So we kind of see these differences. There's also deficits in nonverbal communicative behaviors that are used in social interaction. So we probably aren't even aware of this. But for example, we use our hands a lot. I use my hands all the time to talk. A lot of times with autistic individuals, they don't use their hands as much. So they don't use gestures to emphatic gestures, what we call, to kind of emphasize what they're talking about, or descriptive gestures and say, "Oh, is this big?" or "the roller coaster went like this." Oftentimes they're poorly integrated, the verbal and nonverbal communication. There can be abnormalities in eye contact and body language. So oftentimes autistic individuals have difficulty making eye contact. They might look away. Sometimes their body language, it seems like they're not paying attention, but really they are listening. It's just more difficult for them, or maybe it's uncomfortable to make eye contact. There can be deficits in understanding the use of gestures, what people are saying. There also can be a lack of facial expressions, or a range of facial and nonverbal communication. So often we see individuals with kind of a flat affect. So they're not showing a lot of facial kind of communicative gestures and emotions. And there are also deficits in developing, maintaining, understanding relationships. And that's really where I'll be talking about the peers program. That's where the peers program is really important. So there can be difficulties adjusting behavior to a certain context. So for example, if a friend wants to do something different than what you want to do, it can be really hard for these individuals to change what they wanted to do. There can be some difficulties sharing imaginative play, making friends, and there can be an absence of interest in peers. Again, that is not true for all autistic individuals. Sometimes they want friends so badly. It's just that they might not have the tools, the skills to know how to approach other children. And then the other core domain is this restricted repetitive behavior category. So there can be stereotyped repetitive movements, use of object or speech. So there can be simple motor stereotypies. So a lot of times you think of hand flapping, or kind of doing the same gesture over and over again, lining up toys. That's a big one, or flipping objects, or kind of examining them. So not playing with the whole car, but maybe looking at the wheel and how it turns. There can be echolalia, so that's repeating or repetition of words, and idiosyncratic phrases. So maybe they say the same phrase over and over again, and it might not make a lot of sense, but maybe they've heard it before, like, "Oh, you're gonna get in trouble. You're gonna get in trouble." And so sometimes we see with autistic children, and also with adults as well, that they might kind of repeat it over and over again in the same way. There's also this insistence on sameness and inflexibility. So rigidity is a big piece of autism. So there can be a lot of distress with small changes, a lot of difficulties with transition. So that could be something even like, okay, so now like in school, we're going to move from working on reading to doing art. And that can be really difficult for some individuals. There are also these rigid thinking patterns, or certain rituals that they need to follow. Maybe they require taking the same route to get somewhere, eating the same food, and that can be difficult for some families to navigate and figure out what's going on. And this can cause a lot of distress. And they're also kind of restricted or fixated interests. So there can be a strong attachment or preoccupation with unusual objects, or they might know a ton about a certain topic. So maybe they know everything about trains, and they can tell you all about trains. Somehow the topic always goes back to trains. If you try to talk about something else, they won't really talk about that, but trained, yes, they know all about that. And then also thinking about that they can be hyposensitive to sensory input. And they can, so that means that they can be really sensitive. We think about sensitive to noises, sometimes to certain smells or to touch, really sensitive. But also if they're hyporeactive, then maybe they don't feel that. So it could be, you know, they have like a huge gash on their arm, but they don't even feel anything. There's no pain. So it's kind of thinking about that. It could go, again, either way. And then these are the other criteria that I already talked about. So symptoms are present starting in the developmental period, and they cause clinically significant impairment in these domains. Some other related behaviors, aggression that can sometimes occur, inflexibility or rigidity, which I touched on, emotion dysregulation or emotional outbursts. So this is a big one. So a lot of times individuals don't know how to regulate their emotions. And that's why we spend a lot of time talking about different strategies to help regulate their emotions. Okay, you're upset. So instead of hitting someone or throwing something, what can we do? And we talk about relaxation strategies. And there can be a lot of comorbidity with anxiety and impulsivity or hyperactivity, so ADHD as well. So we know that the rate of developmental disabilities in general has increased in the past decade, and there are social competence difficulties, and this is a core deficit for autistic children and for other developmental conditions as well. As I talked about, there's a decreased ability to make and maintain friendships. And this can lead to lack of initiating or maintaining these social interactions, using and interpreting verbal and nonverbal communication, and understanding others' thoughts and emotions. So it's not only understanding their own emotions, but also others, how others are feeling, which is a really big piece of how we develop our knowledge of kind of social and emotional understanding. So we know that there's weakness in social skills, and they are often evident in early developments. And often these difficulties can worsen over development if they're not addressed, and they can have long-term negative ramifications. And so often by 4 to 6 years, we can see these social challenges. And this is around the time, if not a little bit before, when children go to preschool or they're in kindergarten. And so we can see some of these. And they can increase risk factors, and I'll talk about those a bit more. So it's essential to intervene at a young age and to provide these services really throughout the lifespan, because how we act when we're 4 is different from how we act with peers or with our family when we're 14 and when we're 24. So now I'll move to talking about social skills interventions. So often with younger individuals, social skill or social communication is a top treatment concern. However, the gains are minimal. They're often not maintained beyond treatment. And often there aren't interventions developed that focus specifically on social skills. It's really on that social communication or gaining speech. And so the PEERS program, so the program for the education and enrichment of relational skills, really targets all of these areas that we've talked about. And it's shown to increase social skills for autistic individuals post-intervention. And these gains are maintained 1 to 5 years post-intervention. And this is seen in our preschoolers, teens, young adults, so in all of our different groups. Okay. So as I mentioned, there are a few interventions that specifically target these social skills, especially in younger children. And we've seen that in reviews and looking at the literature. And so we really want to think about how could we help with kind of the social emotional development across the lifespan. And so we know, going back to what we initially talked about, that caregiver involvement is so important. And we're seeing this shift from the professional driven model to a more family focused model. And so it's really important to have caregivers, and that's anyone who spends a lot of time with a child. So it could be parents or grandparents. There's more work looking at siblings. We want them to be involved in these interventions. And there's also a bidirectional effect of autism on the family system. So not only does the family system impact the child, but the child impacts the family. So it's really important, again, that we're looking at all of the pieces of the puzzle. So that's going back to systems theory. And we want to look at outcomes for both caregivers and the family and the child, because that's all really important in looking at gains made, maintenance, generalization. That's a big thing that we talk about. So generalizing the skills, not just in an intervention setting. So not just when they go to therapy, but we want them to generalize to when they're at home and at school and at the park. And intervening early or earlier may lead to enhanced short and long-term outcomes. And again, that's why we really want to focus on providing these tools throughout an individual's life. And having this generalization that I just talked about occur can really be facilitated, or it might be facilitated by including caregivers in these interventions, so they know what's going on, they know what their child is learning, and really no matter the age of their child. And caregiver confidence, we found, is a huge component because the caregiver needs to feel that they know what they're doing and feel confident interacting with their child and acting as their social coach. So peer rejection and social neglect is something that is seen throughout development. So we'll start with talking about peer rejection. So that includes teasing and bullying. If someone has a bad reputation, maybe actively seeking out peers, but being rejected, not included. And this can occur with a number of different diagnoses, including autism, ADHD, mood disorders, impulse control disorders, and a number of other ones. Then there's also social neglect. And so these children are often more isolated or withdrawn. They're ignored or unnoticed. They sometimes actively avoid their peers. So it's not that they're going up and saying hi, that's more of the peer rejection. They're kind of avoiding those interactions. And so again, we see that in a number of different diagnoses: autism, anxiety, depression. We think of these as internalizing disorders. So these are more diagnoses that someone feels these concerns more internally, right? Their thoughts, they're having anxious thoughts. Where with peer rejection, those are more externalizing diagnoses where maybe they're acting out more. And so that's kind of how we differentiate them. So both of these areas, again, can have long-term negative ramifications. And so consequence of peer rejection during adolescence, especially, and as you can see, this increases and this continues from when an individual is young throughout their development. It can include increased rates of depression, anxiety, loneliness, lower self-esteem, substance abuse. They might have poor academic performance. They could withdraw from school earlier. They could have an increased number of suicidal attempts and also increased suicidal ideation where they think about suicide. So there can be some consequences of experiencing this peer rejection. I will also just briefly talk about young adults, though most of this talk is really focused on children. So it's been found that autistic adults have increased rates of all major psychiatric disorders. And there's also a prevalence in mental health conditions and also in their service utilization. So how much they utilize these services. However, they're not really available to them, and there aren't a lot of services available for this population, which is something that we really want to work on. And we know, again, social impairments can result in more rejection, victimization. And it's also in this population, we see that it's related to an adverse health, psychological, vocational, and relational outcomes in this phase of their life. So that's why we really want to target these things early. And we're focusing on providing opportunities for these individuals throughout their life. And again, as I mentioned, there are minimal treatments that are available for autistic adults, and especially for adults that have anxiety as well as autism. And that's something that we see a lot. There are high rates of comorbidity with anxiety and autism. So what do we do about that? Why target friendship? Well, we know that friends and peers are a big system and influence on individuals' life. And this will only increase as individuals get older. And it's also been found that having one or two close friends will predict later adjustment in life and more positive adjustment. And it can act as a buffer to stressful life events. So if you have one or two close friends, then maybe you won't feel the impact of that stressful event. And it also correlates positively with self-esteem. So if you have more friends, then there are higher rates of self-esteem and also higher rates of independence. That's huge. And it correlates negatively with, so that means if you have one or two close friends or more, then there are lower rates of depression and also lower rates of anxiety. So we see here that targeting friendships is really important. And this is just kind of a breakdown of peer acceptance in adolescence specifically. So you see most people are kind of in the average, the blue part of the pie right here. And then their peer rejected and socially neglected individuals are here in the green and purple areas. And then popular individuals are in the red area. So we really want to focus on these individuals and to get them in the blue zone. So finding and choosing friends is really important, even from a young age, as I began to talk about. So friendships are based on common interests, and people often affiliate with specific peer groups or crowds based on their interests. And this is true from a young age. And we really encourage parents to say, okay, what is your child interested in? Let's think about that. Because if they really like soccer, get them signed up for a soccer league. Maybe they'll meet some peers there. And peer groups and crowds are important for giving us sources of friends, finding potential friends with common interests. Maybe you can have play dates or a one-on-one interaction with them. And they can also act as protection from bullying, because bullies are less likely to kind of pick on someone who is in a crowd, who they see, oh, well, they have a group of friends behind them. I don't want to pick on that person. So that's, again, emphasizing the importance of peers. And you want to make sure, as we're talking about social and emotional development, that having those peers kind of consistently throughout an individual's life, it's consistent that they have those peers. So this brings us talking about peers. So that is the program that was developed in 2004 by Dr. Elizabeth Lageson at UCLA. And it has since been translated into over a dozen languages. It's used worldwide. I think in over maybe about 90 countries. And so you can see to the right some of the translations. Those are our manuals, and they've been translated into a number of different languages. So they're evidence-based programs, and that means that there's basically science behind them. So we know that these programs work. And so we have programs for preschoolers, for adolescents, and for young adults. And so those are some of the ages that I've kind of highlighted, and also how you can see that it really is throughout the lifespan. And we have some research programs going on as well. So Peers for Careers, so that's for individuals who are transitioning from college to maybe an internship or an employment opportunity, and teaching the skills that are important for that. Peers for Dating, which is specifically focusing on dating. We talk a little bit about that in our young adult group, and we have a boot camp where we focus just on dating. However, our Peers for Dating group is 16 weeks that's just focused on dating skills. And we also have Peers L-DOPA, which is combining the behavioral intervention with a medication component. And some unique aspects that I want to highlight is one of the only evidence-based social skills program that exists. It's the only evidence-based program, social skills program for autistic teens and adults, and those with other social challenges. So we know that it works, and it's important to disseminate it, to kind of spread the word. It also involves social coaching. So this goes back to what I was talking that it's about in the beginning, that it's so important to involve caregivers. And they're trained to support their participants outside of the group. So whether that's supporting their preschooler or their young adults. So parents or siblings or someone else who works with that individual will also learn the skills so that they can act as an additional source of support. And they're saying the same things to what we're saying in the Peers program. So again, we're looking at all of these systems and seeing the interaction of these systems in an individual's life. And we only teach ecologically valid social skills. And so what that means is that these are rules and steps that are followed by socially successful people. So it's not that in Peers, there are a set of rules, and if you were to go out and use those in another context, then people might wonder, well, what are you doing? They can be used in other contexts, and we know that they are followed by socially successful people. And a big part of Peers, and this is something we really want to emphasize, is that it's not to change anyone, it's not to change who people are, saying that they need to act a certain way. It's really to provide the tools and the skills. So if they choose that they want to employ these skills that were taught, let's say for changing their reputation, then they have those skills available to them. They've gone over them. So it's really kind of their choice. And also, as I mentioned, it's been cross-culturally adapted across the globe, which is really cool. So talking about telehealth. So over the past year and a half, now almost 2 years, there has been, it's really challenged a lot of clinics to figure out effective ways to implement social skills interventions. And a lot of access to these groups has diminished for families, especially of young children. A lot of services have closed or they've kind of stopped, because especially with young kids, because we know it's not realistic to have a 4-year-old on Zoom for an hour and a half. And we know what a struggle that was for people who were teaching their child at home. And it's also true for some of our older individuals as well, figuring out, okay, how do we teach social skills if we're not actually in the same place? So it's kind of caused us and other providers to think critically about how can we effectively teach these skills, these tools in other modalities to kind of get across the same lessons and skills that we want to teach. So we kind of thought about, especially in our clinic, and I know this is true for so many others, it's again challenged us to think about providing patient care in new formats, and we've really had to pivot. And what we have seen, which is pretty cool, is that we have transitioned all of our peers programs to do them virtually, completely virtually. And we've actually seen in our adolescent group, and we're starting to look at some of the results in our other groups as well, very similar results to our in-person groups, which is really exciting to see because we know that it's working. So again, even though we're not in the same place, there are all the individuals and their social coaches, their caregivers are still learning the same skills, which is really awesome. And this also allows us to reach a broader number of people, or people who otherwise wouldn't be able to access the program. And then for peers for preschoolers, again, we knew that providing this instruction over telehealth was not clinically viable, but it was viable to work with their parents or their caregivers. And so that's really what we have done, is developed a program that's specifically parent focused for this age group. And we've seen really great outcomes, and we're continuing to run those groups as well. So some skills to promote. So finding sources of friends during COVID. So this is a big one that we have touched on throughout all of the different phases of COVID. I was actually part of one of the first groups where I think we met twice in person, and then we realized, okay, we're going to have to move everything online. And we would hear from parents, and that's why it's so important to have their feedback, that a lot of their children were not interacting with other peers, didn't really know where to go. And so we really focused on finding sources of friends during COVID. And this is true in all cases, where sometimes people, they don't have anything close by that's really a good source of friends for them. So then maybe look at some other ones. And so we help finding that source of friends. We talk about starting conversations online. And this is actually a really good skill because a lot of conversations now start online, that people will have Zoom calls or FaceTime chats, and then maybe they'll get together after. So we talk about starting conversations in person as well as online. So that's something we've added into our curriculum. We've also talked about joining conversations online, because sometimes there are clubs that are completely online as well. And then having get-togethers with friends during COVID. And we talk about how you can do that online. And sometimes that's actually more comfortable for individuals. It's a nice step before they have an in-person get-together. So we talk about what that looks like. What could you do to have a get-together online? So these are some things that we've targeted. So just quickly talk about the purpose of peers. So for all age groups, we are focusing on making and keeping friends. So really focusing on that social and emotional development. And so we'll do a lot of perspective taking questions where we're thinking about making and keeping friends. And we also talk about handling conflict and rejection, how to go about doing that, how to navigate that. And this is just the structure of the groups. So it's a 16-week program. There are 90-minute groups. So we start with our homework review, where we go over homework from the last week. And I always make sure to tell people this isn't like school homework where we say, write an essay on this or do these math problems. They're assignments more like practice the skill of joining a conversation, or practice handling a disagreement. So it's those types of things. And we go over them. We have a didactic lesson, so it's very structured. We have role play videos, so some of them are really good, some of them are really bad. So all of our individuals can see what it looks like when they're following the steps that we lay out, and then when they're not following the steps. and they have the opportunity to then say what went well, what didn't go so well. We also have behavioral rehearsal exercises where they actually get a chance to practice the skills in the group and they can receive feedback. Then at the same time as our teens or young adults are meeting. And then right now our Peers for Preschoolers groups, it's all kind of parent focused. But as the older individuals are meeting, then at the same time, there is a separate social coaching room. And so they are learning the same steps and how to social coach their child. And then they come back. So we call that reunification. And then we have individual checkouts where we talk with each person individually. And what's nice about Zoom is you have the breakout feature. So let's say we need to spend a little more time talking to someone about something that's going on. We can go into a breakout room, or maybe something comes up earlier in the group. Then we can talk to them in a breakout room. So that's the general structure of the group. As I mentioned, there's a simultaneous social coaching group. And then we also want to emphasize what not to expect from peers. So it's not a friendship matching group. So the goal is not to be best friends with everyone who's in the group. The goal is really to learn these social and emotional skills and be able to generalize them to other situations, to school situations, at home, when you're meeting other people. It's also not a dating group. We make sure that that's really clear. In fact, we have a rule where we say no unplanned fraternization during the course of the group. So they can't get together or talk with people outside of the group during those 16 weeks. But after, they can absolutely exchange information and talk with them, because sometimes people make connections, which is really great. This is not a support group. So we make sure to say, we're not going to spend time going around and saying, okay, what's everyone feeling? It's also not a group psychotherapy. So it doesn't really look like that. And we don't address all problems of group members. We really stay focused on talking about social and emotional development. And we also emphasize that it's important to do the following things to see improvements. So to come to groups regularly and on time, to practice the skills and complete the homework assignments. And this is just a list of some of the skills that we cover. So as you can see, we go over everything from finding and choosing good friends. We have people define what do they look for in a friend. We talk about entering and exiting conversations, electronic communication, the appropriate use of humor, handling bullying. We talk about the different types of bullying, get-togethers, sportsmanship. For our young adults, we talk about dating etiquette, changing a bad reputation. So you can see we talk about a lot of different skills that again go back to making and keeping friends and their social emotional development. And we really tailor all of the different groups to be developmentally appropriate. So for example, we teach all of our preschoolers these skills, and they're slightly different skills, using a puppet show. That wouldn't be appropriate for our teenagers. And so we teach them in a different way using a more Socratic questioning method. And so you can see here, these are our lessons for our preschoolers, and the puppets are right there. And so they're slightly different lessons. And so we might ask or might focus on asking for a turn, sharing and giving a turn, being a good sport, don't be bossy, be flexible, asking and giving help, using an inside voice. So again, we really focus on what's developmentally appropriate for all of these individuals. And I've already talked about some of this. So we have a didactic lesson. We talk about the concrete rules and steps. And they're all ecologically valid. We have role plays. Those are the videos that we show them. Again, some of them are appropriate, some of them are inappropriate. And we ask perspective taking questions, and it can be really helpful for them to see, well, how is the other person feeling in that situation? How could you tell? What was their body language? So we ask questions to get at some of those areas that they might miss. We also have breakout rooms for practice, which is really nice. So we practice in smaller groups. There are those homework assignments that I mentioned, and they can practice in natural settings. That helps generalize the skills. And we also have homework review too, where we talk about what the homework was from the previous lesson. And that also helps us to individualize the program. So let's say some individuals have a really hard time with entering conversations. We'll talk about that a little bit more. Maybe there's someone else who has no problem with entering conversations, but handling a disagreement, that's something that's really difficult for them. So this allows us to focus on that and to provide some more coaching on our end. Okay, and then also this isn't specifically part of the curriculum of peers, but it's something that's really helpful to think about. So I talked a lot about rigidity, but thinking about how to navigate that flexibility. So teaching, especially starts with our preschoolers, but it can continue. So if people say, I'm getting stuck on something, can I get unstuck? Or thinking, okay, you're being a little bit rigid. How can we be more flexible? Talking about compromise, that's really big. And again, that's something that we talk about across all of the ages. And compromising is really important, and it starts from a young age and then continues. Also thinking about plan A and plan B. So what happens if, we had plans to go on a hike, but it's raining? Okay, what's our next plan? And so that's why we always say when they're planning for get-togethers to have a couple of options. And then also handling the unexpected. So again, with the rain example, so what would change? What might stay the same? Why is that change happening? So thinking about some of those things. And again, that's thinking about being flexible, which is really, really important. So a few other suggestions just to think about is to educate yourself and be patient, to listen to autistic individuals, and normalize some of their difficulties. That's really important. So not to say, oh yeah, and everybody is fine with, dealing with conflicts, but to let them know, yeah, I have a really hard time with that too, to normalize that. And really remember that they are different, not less, and convey that to them. And make it really clear that we are not trying to change the wonderful people who they are. It's that we're just trying to provide them with more tools that they can use if they choose to. And it's really important to keep in mind that each person is different. So as I mentioned, some people might have problem in one area or one skill that we're teaching, and someone else might not, but they might have in another area. And that's one thing I love about working with this population, is that everyone is different. And so it really varies how people will respond. And also remember and celebrate their strengths. So that's really important. So we talk a lot in the coaching group to use a lot of praise, or even to give corrective feedback. We call it using a praise sandwich. So you start with the praise, you give the feedback, and then you end with a general statement of praise. That's so important because across all ages, people want to hear praise. I know I still like to hear praise, and that will only strengthen that behavior. And it's really important to highlight what went really well. So that's something that's really important too. And then also think about what you can learn from them. If it doesn't feel like it's this power dynamic, and it's important that they feel that they can express themselves, ask questions. That's so important across all ages because they are learning. And you all are also learning too. So I love hearing what everyone has to say or some of their questions. They're really great. And so here you can just see some of the research that's been done within the US. So we're constantly doing research on these groups, looking at different aspects of the group. Also research is being done outside of the US. And then recently we just developed our Peers app. And it's available, I believe, for iPhones and on Androids. And so you can see all of the role play videos here. All of the different skills are available and you can go at your own pace. So it's really great, and you can have that on your phone, and it allows you either to see what they're doing, or for an individual, if they want to download it, it's easier to see something on their phone, visualize it, then they can follow the steps that way. And here is a link right here to accessing that app. And then here are just all of the different groups that we have throughout peers. So we have our adolescent telehealth group, young adult telehealth group. We have educational classes, and these are with people from all over the country and world, which is pretty cool. And we teach those same skills. As I mentioned, we have our Peers for Preschoolers group, which is just a parent focus group at this time, but it's been great. We have our Peers virtual boot camp. So those are 35 episodes, and you can kind of go at your own pace, which is nice. And so you can watch those role play videos that I mentioned, and some of the topics too. For our peers alumni for teens, there are different meetup groups. And so this can be really great for them to interact with other individuals, and to have fun doing some things if they really like music and poetry, or they really like anime. And we're always open to new suggestions. Here is a flyer and a little bit more info on our College to Career program, which I talked about. Our Peers for Dating group. And so again, this is a 16-week program focusing on dating skills. Our Peers L-DOPA research study. So this is the behavioral piece paired with a medication component as well. Our role play video library is here, and it's available online, I believe, so you can look at some of those role plays. The Science of Making Friends is a book that was written by Dr. Elizabeth Lageson. I believe you can buy it on Amazon. It's really for parents. It focuses on these friendship skills that I've been talking about, how to handle peer rejection and conflict, and these lessons. There are also chapter summaries for teens and for young adults. So sometimes we'll have families that will look at that book and read it first, and then do a peers group. So that's something that's really nice to have too. There are exercises and homework, and there's also a companion DVD with those role play videos. And then we also have, I just wanted to mention that we have trainings for professionals. So we have our young adult training. So if there's someone who, if you want to get certified in being a peers provider, then you can sign up for these telehealth, because it's all virtual, these conferences held at UCLA. And we go over the 16-week curriculum, but we do that in 3 days. So we have one for young adults, one for adolescents, and then our school-based program as well. So those are offered throughout the year. So you can let me know if you're interested in that. And that, I am mindful of the time. I think I met that. And so with that, I just want to thank you all, and I'm open to any questions.
Thank you so much, Dr. Factor. Really appreciate it. I have a question. How can families take part or learn more about the peers program?
Yeah, great question. So there is, so you can see here, there's the link to our website. And then also you can email, so that the Peers Clinic email, just to ask people, would my child be appropriate, or I'm interested in the teen program, and then our coordinator will call them, and there's a phone screen and intake process. And then I'll also mention, so that's through UCLA. There are a lot of providers. So they've gone through the certification programs that I mentioned. And so we have a list on our website of different providers in different areas. So in different states, we do have a lot in California. And so it's broken up into different areas. So you can look on there as well.
Thank you so much. Are there any questions, anyone?
I've gone through the chat and I don't see any questions, Dr. Fernandez, or anyone on the Q&A.
Okay. Yes, I noticed that too. Well, thank you again, Dr. Factor. This was very informative. Just the various ways that various supports that are available, and different programs that cover, again, the wide range age group, to really support that social and emotional skills, and provide that to clients and individuals with that fall into the spectrum. So thank you again for being available, and for providing us with this information. Really, really appreciate it.
Oh, my absolute pleasure. And I am happy to answer any questions too, if other people think of them afterwards. Then absolutely, I'm open to that.
Thank you so much.
Sure thing.
All right, well, if there aren't any questions, we will conclude this session, this town hall. And again, if questions come in, we will make sure to send them your way, so that you may be able to answer them. And then we will be in communication. So thank you again.
Sounds great. Thank you all.
Thank you. Goodbye, everyone.
Take care.